point you brought up earlier about evidence-based care and medicine, Elizabeth, I thought was really interesting. One of the questions that I get asked at the med school all the time by students is, what do they think of evidence-based medicine, or what do I think of evidence-based medicine? And what I often say is that it's very good at telling us what we shouldn't do, what's been proven to be dangerous, harmful or not effective, but it's not really good at showing us what we should do, and what is at the cutting edge of science and medicine is always way ahead of where we are with evidence-based. And the thing with chiropractic as a profession that always concerns me is that we have a two-part profession where you have one group that are not really concerned about outcomes. They want you to come in every week for the rest of your life as a wellness client, and then you have people like we have at Institute of Sports and Spines that have a defined outcome in mind. We have a goal that we're trying to achieve, whether it's returning someone to sport following an ACL tear, reconstruction and rehab, or whether it's they're trying to improve their bike setup to stop their neck pain getting sore. So we have these heretical chiropractors that sort of do us a disservice by really not focusing on outcomes. What has been your experience working here in regards to those different approaches to treatment and approaches to care?
I think it's really important to distinguish between the two different approaches of chiropractic, being the wellness and the outcome. As physiotherapists, we heavily rely on evidence-based practice. It's required from the APA Association, and it means that we provide the best outcomes for our patients because we're relying on the research, which guides our practice, as well as clinical experience. So I think it's really refreshing to know that chiropractors of the outcome focus are also following that same stream. And for the wellness chiropractors, I think that obviously they still have a place in the community serving people, but that you'll get different outcomes and different progressions with those sort of treatment approaches.